Hi, folks. It's Paul Ramsey, and I'm joined by Roger Woods, who is presenting a 2-hour workshop at the 2017 NGH convention. The title is Verbal Medicine, Covert Hypnosis Used in the Emergency Department That Can Work Anywhere. How are you, Roger?
I'm doing good. Thank you, Paul.
Thanks for having me here and being here with me. So tell me about how you got into hypnotism.
Well, going to nursing school, part of one of the prerequisites, they were offering a hypnosis class. So I did that. Really did really well in that. And then I could see the value of using some of those techniques to enhance the rapport, the communication between patient and nurse. So I took that to heart, and I used some of those techniques. And the more that I discovered those techniques worked, I wanted to know more. So it took a little while for me to get back and to take a course. So about 10, 15 years, about 15 years to go get a course under my belt. And I did. And I got trained about 4 years ago down in New York with Mark Schwimmer at the New York Hypnosis Center.
Cool. Of all the things that you've learned about over the years, all the different techniques and things you've picked up, tell me about why you chose to present on this topic. Why is this topic important to you?
So my partner and I, Mark Sacco, who's also a registered nurse, we both got trained together. We noticed the first day when we took our training how some of the techniques that we were learning could enhance the ability for us to help our patients, to lead them down that path of health, to help them realize that everything that they need is within. Change their perception, you can change the outcome. A lot of them are out of control. They are out of control. We've taken all of their control from them, right? We dress them up in a little gown. We do all these procedures. They're out of control. If you can give them back some control by using language, appropriate language, you can lead them and help them recover faster and, even quicker, believe it or not, without the aid of any additional medications.
That's wonderful. That's great. I'm looking at your learning objectives right now. I like these. I mean, very, very reasonable. Identify the use of 3 covert hypnosis techniques during initial assessment of an emergency room patient. Describe the techniques used to relax and gain compliance with trauma patients. Name 5 common words that can set up patients and staff up for failure or success. And you're going to describe 6 case studies in which covert hypnosis was dramatically successful in the emergency room. These are great. These are wonderful.
Well, 6 for now. We have thousands. We've been doing this.
Right?
We've been doing this for 4 years in our emergency department. We've seen nearly close to about 18,000 patients between the two of us, conservatively, that we've used some technique. Now, it could be just relaxation. They could be putting them all the way down to do a procedure, and we'll discuss that too.
Cool.
We have had phenomenal results, and not only that, we are modeling great behavior for all of the other healthcare professionals. Doctors, nurses, techs are all looking and learning, and they're using them. They're using their words to help drive the care, and that's what we need to do. Drive the care, drive their perception from a place of hurt to a place of healing. So we've been very, very successful. And nurses, believe it or not, are natural-born hypnotists. People come in with an expectancy of care. So we are subject matter experts, so we can drive their care and influence them in a very caring way.
Awesome. Roger, tell me about, you have this listed as an all levels workshop.
Sure.
Your learning objectives use words like emergency room and trauma patients a lot. So just for people who might get nervous about that, they're like, well, that's not my world. Tell me, and therefore tell them, where's the crossover that can bring people of all levels here? How is learning about this going to benefit people of all levels?
So we don't do this in an office with beautiful surroundings, nice, pleasant smells, music. We don't do that. If we can do this in a place of chaos, you can have the confidence to do it anywhere. We're going to show you some techniques that will enhance your ability to communicate and also to perform. And that's why we say it's open to all levels, and everyone's welcome.
Cool. That's great. if people want to learn more about you and what you
Yeah.
do and what your partner, your co-presenter do, what's a good way for them to learn about you guys more?
So we have a website called patientwhisperers.com. It's our own dedicated website. We have information of classes that are coming up, some books that we are working on, and some presentations that are available to anybody if they just want to reach out and have us come present. And we're available most days to talk to people. We have a clinic every Wednesday that's open for all of our non-hospital clientele, because we can pick and choose who we can work with, who we want
Sure.
to work with. We only want success. So, we have many avenues where we can really put out the message. It's more important the message rather than teaching. We want people to learn, but actually do the work.
Sensible. All right, you guys, this is one of those things is where, you can go to 1 hours, and sometimes it's absolutely appropriate to go to 1 hours to get an overview of a topic and start to get introduced to a topic. And then sometimes you get a chance to go to these 2 hours and really drill down deeper on skills and techniques and learn how to really apply in a specific area of practice. And to me, this sounds totally like one of those workshops that does that for you. Verbal medicine, covert hypnosis used in the emergency department that can work anywhere, with Roger Woods and Mark Sacco. Roger, thanks for making this time for me.
Thank you, Paul. I'll see you soon.
All right, take care.
Bye-bye.